Before you start taking Xalkori, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. Swallow whole with a glass of water. Do not crush or chew this medication. If you vomit after taking your dose, do not take an extra dose. Take the next dose at the regular time. The dosage is based on your medical condition, lab tests, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. For children, the dosage is also based on body size. To decrease the risk of side effects, your doctor may prescribe other medications to take along with Xalkori. Carefully follow your doctor's directions for all your medications. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. Do not increase your dose or use this drug more often or for longer than prescribed. Use Xalkori regularly to get the most benefit from it. To help you remember, use it at the same times each day. Since Xalkori can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the capsules. You may experience side effects such as nausea, diarrhea, vomiting, dizziness, tiredness, headache, heartburn, change in taste, loss of appetite, mouth sores, joint pain, trouble sleeping, or constipation. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Keep in mind that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. It's important to know that this medication may lower your ability to fight infections, making you more susceptible to getting a serious infection or worsening any infection you have. If you experience signs of infection such as cough, sore throat, fever, or chills, tell your doctor right away. Be sure to contact your doctor immediately if you have any serious side effects, including vision changes, swelling of the legs/feet/hands, symptoms of lung problems, eye pain/swelling/redness, fast/slow/irregular heartbeat, severe dizziness, fainting, easy bleeding/bruising, or symptoms of liver problems. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. Crizotinib can cause a rash, which is usually not serious, but it's important to let your doctor know if you develop any rash. Remember, this is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. Before taking Xalkori, make sure to inform your doctor about any allergies you may have, as this medication may contain inactive ingredients that can cause allergic reactions. Also, let your doctor know about your medical history, especially if you have kidney or liver problems. Xalkori may affect the rhythm of your heart, causing serious symptoms that require immediate medical attention, such as fast or irregular heartbeat, severe dizziness, or fainting. This risk may increase if you have certain medical conditions or are taking other drugs that can also affect your heart rhythm. Talk to your doctor about all the medications you are taking and any heart conditions you may have. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems while taking Xalkori. If you are using diuretics or have conditions such as severe sweating, diarrhea, or vomiting, discuss with your doctor about using Xalkori safely. Xalkori may increase your risk of infections or worsen existing infections. Stay away from people with contagious infections and inform your doctor if you have been exposed to an infection. This medication may cause dizziness or vision changes, and alcohol or marijuana can increase these effects. Avoid driving or using machinery until you know how Xalkori affects you. Also, limit alcoholic beverages and talk to your doctor if you are using marijuana. Xalkori may make you more sensitive to the sun, so it's important to limit your time in the sun, use sunscreen, and wear protective clothing outdoors to avoid sunburn or skin redness. Inform your doctor about all the medications and herbal products you are using before having surgery or dental procedures. Older adults may be more sensitive to the side effects of Xalkori, especially heart rhythm problems. Ask your doctor about the effects of Xalkori on fertility, as it can affect both males and females. Women who are pregnant or may become pregnant should not handle Xalkori or breathe in the dust from the capsules, as it may harm an unborn baby. If you are pregnant or planning to become pregnant, your doctor will order a pregnancy test before starting this medication. Reliable forms of birth control should be discussed with your doctor during treatment and for some time after the last dose. Men using this medication should also discuss reliable forms of birth control during treatment and for 90 days after the last dose. Breastfeeding is not recommended while using Xalkori and for 45 days after stopping this medication. Always consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Xalkori, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. Some products that may interact with Xalkori include medications that may slow the heartbeat, such as digoxin, clonidine, and certain beta blockers. Other medications can affect the removal of Xalkori from your body, including azole antifungals, macrolide antibiotics, rifamycins, drugs for seizures, and St. John's wort. Xalkori can also slow down the removal of other medications from your body, affecting how they work. These medications include alfentanil, ergots, fentanyl, and tacrolimus. Additionally, many drugs besides Xalkori may affect the heart rhythm, including certain antipsychotic medications and drugs for heart conditions. Always consult with your doctor before taking any other medication alongside Xalkori. If someone has taken too much Xalkori and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share Xalkori with others. Before starting and while taking this medication, you may need to undergo various lab and medical tests such as liver and kidney function tests, EKG, blood counts, eye exams, blood pressure and heart rate monitoring. It is important to keep all medical and lab appointments and consult your doctor for more information on these tests. If you forget to take a dose of Xalkori, take it as soon as you remember. However, if it's less than 6 hours before your next scheduled dose, then it's best to skip the missed dose. Just take your next dose at the regular time and do not take a double dose to make up for the missed one. When taking Xalkori, it's important to store the medication at room temperature in its original container, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to dispose of Xalkori. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.